Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're diving into a topic with real stakes, the federal government shutdown. You've heard about the shutdown probably in passing, but what does it really mean for public health, for patients, and for the work that we do every day? In this episode, we'll walk through, number one, what a government shutdown is, how it happens, how it's been used historically, and what functions are disrupted. Number two, how this particular shutdown is hitting U.S. public health agencies, programs, and patients. Number three, why Congress is deadlocked, including the fight over Affordable Care Act subsidies and Medicaid cuts, and what that means for healthcare costs. And number four, the prospect for a deal or more damage ahead. Let's begin with the basics. What is a federal government shutdown? Well, each year, Congress must pass appropriations bill, or a continuing resolution, sometimes called a CR, to fund federal agencies. If no law is approved by October 1st each year, there is a lapse in funding, or a shutdown. A shutdown is not new. Over the past 30 years, there have been numerous shutdowns, some brief, including a day or two, and some extended, when negotiations break down. In a shutdown, mandatory spending programs, including Social Security, Medicare, Medicaid, continue because they are authorized outside the annual appropriations process. What does stop or slow down are what are called discretionary programs, those that are funded annually, including some core public health operations such as research, health communication, regulatory oversight, agriculture inspections, nutrition programs, and more. Over time, agencies develop contingency staffing plans. They classify which roles in their agencies are accepted, those that must continue for safety, legal, or essential mission reasons, and those which are furloughed. As a note, in 2018 and 2019, the government shut down for 35 days. Many public health, FDA, and grant programs were put on pause during this time. Some agencies delayed research and critical services were strained. So that's the general mechanism. But what's unique and especially concerning about this shutdown is how deeply public health functions are already under strain, even before the shutdown, and how many programs are vulnerable. So what are some specific impacts on public health agencies and programs? Because many public health functions are discretionary, a shutdown puts them at serious risk. Let's break down what's happening and what we expect to happen across key agencies and programs. Let's start with HHS, Health and Human Services, the CDC, the NIH, and general furloughs. The Department of Health and Human Services announced that it would furlough 41% of its workforce, roughly 32,000 out of its nearly 80,000 employees. The Centers for Disease Control and Prevention, the CDC, is particularly vulnerable. Approximately 64% of its staff may be furloughed under contingency plans. The National Institutes of Health, the NIH, may furlough up to 75% of its personnel, threatening research, clinical trials, grant reviews, and core operations. The FDA retains a higher proportion of accepted staff, 86%, to continue essential drug approval and safety functions, but many non-urgent reviews and inspections may be delayed. Other programs that relate to public health that are under threat include nutrition assistance, which supports over 6 million low-income parents and children. This is already operating on a contingency fund. If this fund is exhausted, states would need to pick up the slack, and not all states have promised to do so. A hospital at home, Medicare Flex programs. Some patients receiving inpatient-level care at home could be forced into hospitals if waivers or funding lapses. Telehealth in Medicare. Many telehealth flexibilities require statutory support. Some providers are saying that they may halt telehealth services if funding doesn't cover patients. Food safety and inspections. Routine inspections by the FDA and agriculture agencies may pause, potentially affecting safety, oversight of food, drugs, and livestock. State and local public health. Without CDC communications, technical support, disease surveillance, state and local health departments may struggle to track outbreaks, continue their campaigns for vaccines, deliver education, or generally respond to emergencies. Community health centers and safety net clinics. Many of these clinics rely on federal grants or support. Disruptions in funding or staffing could force reductions in service, hours, or outreach. So how is this going to impact patients? Well, delays in guidance updates or disease surveillance or public communications could all have an impact on patients and the general public. Gaps in immunization programs, especially in underserved communities, could also be impacted. not to mention the increased strain on health systems already stretched thin by workforce shortages. To be clear, even in a shutdown, many essential functions continue, but the depth, duration, and degree of the disruption will depend on how long this impasse lasts. So, why is Congress at an impasse? Well, the politics here are deeply tied to healthcare policies. One of the main sticking points is the Affordable Care Act enhanced premium tax credits and Medicaid cuts. So, as we all learned, I think, in junior high school, in order to get anything passed in the Senate, you require 60 votes to avoid a filibuster. So while Republicans have a majority in both the House and in the Senate, they don't control 60 votes in the Senate, and as a result, Democrats have withheld enough votes to essentially stop the continuing resolution from passing. The reason they have done this is basically over various healthcare policies. So let's get into it. Affordable Care Act subsidies at risk. The enhanced ACA premium tax credits, which were expanded during the pandemic and extended through the Inflation Reduction Act, are set to expire at the end of 2025. Without an extension, many people will lose subsidies or see their health insurance premiums more than double. Democrats are demanding any funding agreement include a restoration or extension of these subsidy protections. Medicaid cuts. Republicans in the GOP spending bills have proposed significant changes to Medicaid funding, block grants, work requirements, and things of that nature, and reductions in subsidies for lower-income Americans. Democrats are arguing that these cuts would push millions off coverage or into higher-cost insurance, especially amid increasing premiums. So here's what's going on. Republicans passed a short-term funding bill, a continuing resolution or a CR through the House, extending funding through November, but it failed in the Senate, as I mentioned, due to lack of Democratic support to get to the 60-vote threshold needed to overcome a filibuster. Republicans argue that health policy changes should be negotiated separately, not as part of a continuing resolution. Democrats say that the moment is now. They view the expiration of health subsidies as too urgent to delay and are trying to force the issue. Underlying this standoff is the broader tension over deficit pressure, priorities, and discretionary cuts, and ideological disagreement over the federal role in health coverage generally. The White House has also signaled it may not tolerate a shutdown, but use the moment to push for structural changes. Threats of agency restructuring, permanent layoffs, and other reductions in programs not aligned with the White House's agenda are also in the mix. To sum up, the disagreement isn't purely about dollars and timing, it's about which health programs survive in 2026 and who bears the burden of rising costs. So, what are the prospects for a solution and what should we watch? At present, a few paths forward exist, and each of them has risks. So, number one would be a short-term continuing resolution. Republicans and Democrats could agree to extend the current funding levels for a few weeks or months while substantive negotiations continue. This is often the fallback during shutdowns. Another idea would be a conditional CR tied to health policy concessions. Democrats may insist that extension bills include provisions to restore ACA subsidies or prevent harmful Medicaid cuts. Another idea would be a separate reconciliation or health bill pairing. Post-shutdown, Congress could reinsert health policy into must-pass budget vehicles or reconciliation packages. A partial reopening. Some key health functions might be partially reopened using emergency declarations or carve-outs. Permanent cuts or policy shifts. Some leadership may seek to impose structural changes during the shutdown window, anticipating lower resistance. So here's what we're looking for. The duration. How long is this going to last? The longer the shutdown lasts, the deeper the damage. Even just a one-week shutdown can disrupt grant cycles, clinical trials, vaccine programs, and state health operations. Congressional movement. Will the Senate Republicans cooperate? Will the Democrats cooperate with the Republicans? Can Democrats compromise on timing or health carve-outs? We will see. Public pressure. Will public pressure mount against the Senate? Specifically, will it mount against the Democrats or will it mount against the Republicans? If advocates build visible pressure, it may push leaders to strike a deal. Unintended fallout. Deferred regulatory approvals and paused clinical trials and loss of trust in health agencies could linger well beyond the shutdown's end. So, in closing, a government shutdown is more than just a theater. It touches the systems that people depend on, especially those with chronic illnesses, those in underserved areas, and families relying on safety net programs. As the standoff continues, patients must not be collateral damage. We'll continue to monitor developments and help you understand what's at stake and how we can all push back together. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.